At some point in their lives, about 40% of men struggle with lasting as long as they want during sex. And if you're over 60, you're not alone in this. In fact, age-related changes can make this concern feel even more frustrating and confusing. I'm Dr. Julia Rhodes, a men's sex therapist, and for over a decade, I've worked closely with men and long-term couples navigating changes in sexual performance, confidence, and intimacy later in life. Today, we're going to talk honestly about lasting longer in bed, what premature ejaculation actually means, why it becomes more common with age, how it affects your mental well-being, and most importantly, what actually helps. Let's start with clarity. What is premature ejaculation? At its core, premature ejaculation simply means that ejaculation happens sooner than you or your partner would like, leading to frustration or distress. Clinically speaking, if this has been present most of your life, ejaculation typically occurs within about 1 minute of penetration. If it developed later in life, it's usually defined as ejaculation occurring within roughly 3 minutes. But for men over 60, the clock isn't the real issue. What matters more is how this affects you emotionally. Many men I work with describe loss of confidence, anxiety before intimacy, a sense of disappointment or embarrassment, fear of letting their partner down. And over time, these feelings can quietly chip away at self-worth and desire. This is not just in your head. It's a very real mind-body issue. Why does lasting longer become harder with age? Premature ejaculation rarely has just one cause. In most men, especially later in life, it's usually a combination of physical, psychological, and emotional factors. Physical contributors. One important factor is hormonal balance. Changes or abnormalities in testosterone levels can affect ejaculatory control, sensitivity, and arousal patterns. That's why checking hormones is often an important first step, even though correcting testosterone alone doesn't always fully solve the problem. Another physical contributor is increased penile sensitivity, particularly around the glans or the frenulum, the small band of tissue beneath the head of the penis. Heightened sensitivity can lead to faster arousal and quicker ejaculation. Psychological and emotional contributors. This side becomes especially important after 60. Stress, whether from health concerns, finances, work transitions, or caregiving, plays a huge role. Performance anxiety is another major factor. Once a man has one disappointing experience, it often stays in his mind during future encounters, creating a self-reinforcing loop. Depression can also dampen sexual control and pleasure, and if there are unresolved relationship issues or communication breakdowns, the bedroom often becomes the place where those problems show up first. So, what actually helps? The good news is that there are effective, evidence-based options, and many don't require medication. The best approach depends on what's driving the issue for you. Let's walk through the main ones. Behavioral strategies. These are often the first place to start and can be very effective when practiced consistently. One common method is the stop-start technique. This involves pausing stimulation just before ejaculation, allowing arousal to settle, and then starting again. After repeating this cycle a few times, ejaculation is allowed. Over time, this trains your body to tolerate higher levels of arousal without climaxing. Another option is the squeeze technique, where gentle pressure is applied to the head of the penis when arousal peaks, reducing intensity and delaying ejaculation. These methods work best when your partner understands what you're doing and supports the process. Many men also practice these techniques during solo stimulation to build awareness and control without pressure. Pelvic floor awareness. Pelvic floor muscles play a major role in ejaculation control, but this is where many men get confused. You may have heard about Kegel exercises, but here's the key point. Many men with premature ejaculation already have an overly tight pelvic floor. In those cases, doing strengthening exercises can actually make symptoms worse. Learning how to relax and coordinate these muscles is often far more helpful than simply tightening them. Working with a knowledgeable pelvic floor therapist can make a significant difference. Breathing and physical training. There are also low-risk approaches with surprisingly strong results. Deep diaphragmatic breathing, slow, controlled breathing into the belly, has been shown in studies to dramatically increase time to ejaculation. One study found improvements of up to 9-fold. Breathing helps regulate the nervous system and keeps arousal from escalating too quickly. Another helpful tool is short, high-intensity interval training. This kind of exercise improves body awareness and internal control, which translates surprisingly well into sexual stamina. In one study, just a few minutes a day led to measurable improvements within weeks. Reducing sensitivity. If heightened sensitivity is a major factor, topical delay products can help. Both over-the-counter and prescription creams or sprays, usually containing lidocaine or prilocaine, work by gently reducing sensation. They're typically applied about 10 to 15 minutes before sex. Finding the right amount is important. Too much can dull sensation excessively or affect erections, and residue can transfer to a partner if not washed off. Used correctly, however, these products can be very effective. Medication options. There are currently no medications specifically approved for premature ejaculation, but some drugs are prescribed off-label because of their side effects. Certain antidepressants, known as SSRIs, can delay ejaculation when taken daily. These medications require medical supervision to find the right option and dose. Another medication, duloxetine, can be taken only when needed, but it is not available in the United States. In some cases, other medications have shown benefit, but side effects must always be considered carefully. When erectile dysfunction is also present, this is very common in men over 60. If you're worried about losing your erection, it's natural to rush intercourse, and that can train your body toward quicker ejaculation. In these cases, treating erectile dysfunction often improves premature ejaculation as well. Medications like sildenafil or tadalafil can help restore confidence and reduce urgency, allowing your body to slow down naturally. The role of sex therapy. This is where my work comes in. Premature ejaculation is rarely just mechanical. Working with a trained sex therapist helps you address anxiety, thought patterns, emotional pressure, and communication with your partner. For many men, the most effective results come from combining physical strategies with psychological support. And one thing I always emphasize: this is not a quick fix. Improvement takes time, consistency, and patience. Most approaches require weeks, sometimes months, before meaningful change occurs. Final thoughts. If you're over 60 and dealing with this, know this: you are not broken. You are not alone. And this is not something you just have to live with. With the right combination of education, practice, medical support, and emotional care, lasting improvement is absolutely possible. If this video helped you, take a moment to subscribe, leave a comment, and share what stood out to you most. I'm Dr. Julia Rhodes. Your sexual health still matters at every stage of life.